Thanks a lot, Chris, and thank you all for letting me have the opportunity to share my experience. If I explain who I am, until last year, I retired in about May last year. Before that, I'd never had any experience of the NHS as a clinician or anything like that. I worked, but I was a patient, so that was my only experience as a patient. And I worked in quality in industry effectively, and I came into retirement, and I thought I'd do something in the NHS. My other experience had been as a carer, but that's another issue. What I'm going to cover today is my own experience of getting the online access, how useful it's been generally. I look at each of the areas of transactional and the records access, and then I'll explain my own experience and the personal benefits that I have received, and what I think everyone should have. I think everyone deserves that experience. So I'll be going through it in that area, what my online access, how it was facilitated, and the scope of the access. I'm with a medical centre or a GP practice in the West Midlands, where I live, so that's why I was there. And they were fairly up to date on, before 2014, on giving access via the prescriptions online and booking of appointments. It hadn't been pushed much, but it had been done. And then when coming up to retirement, I was in an industry where we had worldwide visibility of transactions, and we benefited from that. So I asked my GP, I found out about the power of information, and I asked the GP, well, when is it online for me to have access to my records? And the GP said, I don't know about it. So he said, why not join the PPG? So I did in May 2013. And I got it on the agenda of the PPG, and it was accepted from January 2014 that I had access. I'm encouraging the PPG to promote it to patients now and explain the benefits, and in 2016 we're looking to embed it and take it on board and share the benefits that I personally have. So that's a bit of the background. What do I see? I'm with the other large supplier. I'm with TPP. So when I go online, I see, well, the patient online actually gives GP appointments, repeat prescriptions, and view my own records. When I go online, I see that. I'm presented with that screen. That's a TPP screen that is seen by a patient. Now, what one query they had, and this is where it's not really being thought of about patients, is one of the big gripes my doctor had, my GP had in his practice, was he couldn't see what I could see. He saw his view, but he couldn't see what I was seeing. So that's an issue that is taken up with the supplier to actually say that it would be helpful to do that. So when I got that, how does that fit in? It actually goes into the booking appointments, looks at the prescriptions online, and sees how I can view my own records. So what is good and what could be better? I've had a thought of this, I've used this, I'm quite a wide user of systems anyway, and I like simplicity, things that are intuitive, things that people use. You know the type of thing, the website that you go onto and you think, oh, that was a good experience. You know, I'll go back there again, no problem using it. Sort of the Marks and Spencer with a credit card. You give that to some people and they'll spend away, they'll find a way to use it because it's user-friendly. Amazon I use a lot, and other ones. There's some websites though you go on and you think, oh, I don't want to go there again. It's too difficult. And the GP one at the moment, and this is what I'm trying to encourage the suppliers to change, is not focused on the patient. So what are the benefits I experience? Looking first of all at appointments online, they do save time with phone calls. I can make a phone call, or I can book an appointment 24/7 whenever I want. My job involved running a project that involved overseas, and I was working till 3 in the morning sometimes, and I thought I'd like to make an appointment. Tidy it up after sort of having some sort of conference call, but I can now. I can view the appointments as I can see and book reviews as required. I feel more in control of my record, and I can see things that are wrong. For example, I had a DNA in 2010, and that was only a minor matter. It didn't matter that it showed, but I thought, well, maybe it shows that I didn't attend, but there's a story behind that. I had a stroke in 2008, wasn't feeling well, went on a Friday afternoon to the GP. GP took blood pressure and said, oh, come back Monday and we'll sort you out. I didn't go back Monday, I had another stroke on the Sunday. So, you know, I had a DNA against my name, so it's just amended. But it wasn't important really, it was just to tidy up the records. What could be better? You've got a printout of those. I won't go through them all in detail, but they aren't patient-centric. They're very few times available. Only very few appointments are put online. There's one Huddersfield doctor, for example, who puts every single appointment available online. At midnight he switches a switch and all the appointments for the day come online. And he said it's been surprising that the elderly people you think would be disadvantaged, but they're not. Their relatives can make the appointment for them. They know when they come online. And about 25% are taken up by 8:30, which is a surprising effect he found, is that it's reduced the pressure on the phone calls, reduced the hassle, receptionists, and the receptionists like it. They've got time to deal with the people because they aren't so blocked with calls. So at the moment, my GP only puts about not even 10% online. So I often go online to book an appointment, there's none available. So if you keep on going onto a website and there's none available, you don't tend to use it, do you? I think in normal situation, there won't be a demand. People say, well, there's no point. Looking at the repeat prescriptions, the benefits, no need to visit GP for a prescription. I could order my prescriptions, they're coming up for, I need another set. I've got 8 medications I take, and they're coming up, they're renewed monthly. I can go on there and order them when I want, anytime, anywhere. I can just order them. A useful thing as well, it's safer. A renewal fell out of sync between the whole 8, and there were 2 sets. So I ordered 2 sets, having to go to GP to renew one of them. And the pharmacist said to me when I went to collect, you've got 2 sets, have you got them all? Are they right? I said, I don't know. I called up my record on the phone and said, you check. You know, I can't pronounce the names, he can, he's trained to do that. And he felt safer that he'd given it to me. I felt safer that they'd been checked. The other occasion when I've used that, when I was going through airport customs, and they said, what are all these pills in your hand luggage? And I said, well, there they are, I have a list of them. I don't have to carry paper or newspaper or remember that. I've got it, if I've got my phone on me, I've got it 24/7. I've got the list of my medication. And again, when you go to a pharmacist, they say, I had a pain in the leg, said some cream, and they said, what medication are you on? I could just give it to them. I don't have to remember. So that's one of the biggest, safest benefits as far as prescriptions are concerned. What could be better? There were a difference in the repeat periods. My GP has sorted that out now. Flags to warn when it's coming up for review. If they had different times for review, and I mentioned that I had 2 lots at one pharmacist once because I hadn't picked up that I had to see the doctor before they could be renewed. So they were out of sync. It would have been appreciated, a flag coming up and saying, hey, you need to renew them. It happens on other sites, so it should happen with that if it's patient friendly. And a hyperlink to the medication. I personally don't like paper in a quality sense. Any paper that's printed is out of date the minute after it's printed. It could be updated. I prefer a link in the record direct to the side effects of the medication. It's just the thought that it could be better. Looking at records online, looking at summary records, I know Chris mentioned this, I think it's a waste of time. No use at all. In fact, it's dangerous for patients because it's given a false promise that you can see your records, and it's only a summary that they can see on prescriptions. it's good in one way. It's got the medical profession and GPs traction that it's breaking the culture a little bit and giving something. But hey, it's not been any use to me. Looking at detailed records, I can see who's had access. I can see if anybody at the GP surgery has looked at my record, a receptionist, for any reason at all, anybody. It's safer than a paper record, more secure, because you can see an auditor. It's like when you go onto your bank account. You know, you can have a look at your bank account and see the last time you checked in. It tells you. Digital can do that. Digital, in my view, is much more secure than paper. Looking at the review, I'll cover the specific aspects. We've got an aspect in there about depression, but I'll mention that when I go on to the third part of showing what it's about. What could be improved, mainly the summary record, as I said. I struggled to keep that list only to 2 items with summary record. I just think a summary of your record is good, but providing you can see the full record to be able to see it all. Detailed record, that's not a contradiction, there's no summary available. The full record isn't patient friendly, it's just a list of every meeting, everything in order. I can't search the list, there's no trends for different items. GPs have a trend, but it hasn't been thought of by for the patient yet, and it's not patient friendly and intuitive. If I wasn't used to the systems, and most people are, but if I wasn't used to it, I'd find it difficult for a reason to go back there. It's not very friendly whatsoever. But it hasn't been designed for the patient, it's been designed for clinicians, by clinicians really. Okay, we're going to the last bit, looking at the benefits to my health, my own health and well-being. Now I've got full access. I've got full access to the notes, not just coded information. I can go and see the notes that the GP puts in. And I've heard people say, well, you don't want access to your notes because it's too complex. They write things that you wouldn't understand. You know, how condescending, I wouldn't understand. I couldn't look up. But still, we'll have a look at one note. And I'm going to share my notes here, so if there's any GPs in the room, and I think there were a couple, weren't there, Chris? If you notice anything that my GP's missed, please tell me. It'll be useful. I'm going to actually share my actual record. We're going to look, first of all, at 2 areas. Looking at, I've got type 2 diabetes, they found that out when I had a stroke. And I have blood tests now and again. Annual review, I had a blood test on the 2nd of Feb in anticipation of a 30-minute annual review on the 9th of Feb. On the 3rd of Feb, I was sitting at home and I thought, has a blood test come through yet? And it had. It was there. This was the various test results. You might say, well, some of those words I can't even pronounce. You know, looking at them, if I copied and paste and try to look on Google, I might get up to a completely wrong website and get wrong information. But on there, within my record, I can click on any of those tests and get information about the test. How is it requested, what it's about, how good it is, what's the acceptable range. I could sit there in my own time and look at my record. I could ask someone in the family if I wanted. And that is readily available. I could go for the blood test for my diabetes review. There were 14 different tests results. And I could look at them all. So I looked at them all before I went in for the review. In fact, the review, I was able not then to concentrate on blood test results when I saw the clinical nurse for the proposed 30 minutes, because we didn't talk about blood tests. I was quite happy with them. We talked about I had diabetes or diabetic control that was important. And I remember she asked me, well, how many sugars do you take in your coffee? And then she said to me, take less. And I remember that, and I went home and I could see it on the screen. In fact, my partner asked me, do you want a coffee, how many sugars? Because her memory is gone, that's why I care for her. and I thought she'd have been having a look at my record and was testing me out, you know. But I remember that I had more value from that review last year than I'd ever had. And the surprising thing was, because I was able to go check it up, the surprising thing was that it only took 10 minutes instead of half an hour. Imagine if the practice has got 1,000 patients who've got diabetes and they've saved 20 minutes per diabetic. That would be 300 hours saving. And for hard-pressed doctors or GP practices, 300 hours. Shows you where efficiency can come. The other one is probably more important. Online access on records helped change my own culture towards my own healthcare, and it's benefited my health here, particularly the mental health. I went to the GP coming up to retirement, and I said, well, I'm thinking of retiring early, and he knew I had problems with caring, and you know it's a big lifestyle change, and I got emotional because of my stroke, and he suddenly said, I think you're depressed. And I thought, well, I could have gone away worrying that on my mind, but my immediate response was to go home, see what he actually wrote. And this is what he wrote. You know, depressed mood, came to realise not I was mentally shocked, that's true. I came to a realisation that the strokes had left me with a bit of physical disability and it probably left me with not so much mental capacity to do what I used to do. So my response was, sit down, what does depressed mean? What is depressed? So I did research. I found an app that's got 21 questions on a Beck standard. I don't know, it's on an app. And it told me, it let me measure on the sort of a multi-choice questionnaire. Very easy, I can monitor it now. It said to monitor me in a month's time. He didn't monitor me. He didn't give me any medication. It actually made me think, well, I need to do something to improve some of these scores. And that's partly why I got involved with the NHS. It was something else to do after I retired, but it's under my own terms. So, and I'd actually challenge anyone, I know you guys are sort of clinicians and work with clinicians, anyone, not to say anyone wouldn't understand that. It's very straightforward, isn't it? And that's one of the notes that I benefited from and I personally benefited. So it's confusing. I take the view that I think this week's self-engagement week or self-assessment week within GPs, PPGs are encouraged to get patients involved with their own health. But at the same time, the message used to be, we want you to take more ownership of your own health, but hey, we don't trust you to see your record. Total dichotomy, totally changing. So now my culture has changed. I trust the record. The GP's done that with me. It's given me greater involvement in my own well-being. I feel more in control. I feel my sort of physical health is more on the par with my financial health. I can check any time I want where I want to check up and have a look what was said and remind myself of that depression state, or remind myself of I shouldn't have sugar in my coffee when I fancy it, see what they say. I'm more inclined to visit the doctor as required. I know when I was in my probably mid-40s I had an issue, I wouldn't go to the doctor. He would write something that I would never see. And that could be shared amongst insurance companies, might get back to my work, so I wouldn't go. That was my view. But I feel in control of my own health now. I feel more inclined to be engaged with it. And it's given me, you know, my mental health has particularly benefited. So, as I said, I hadn't been to the doctor in my 40s, and I hadn't been to the doctor until I had a stroke in 2008 for about 30 years. I was fit. I didn't smoke. I drank socially. Hey, even when I was 50, I won the marathon. I got talked into running the London Marathon and I achieved that. So why did I need to go to the doctor? I didn't really get involved in my health. The one big bad thing, you know, that I had was that I probably worked too much and didn't take enough exercise, but I can't do everything. So that's me. It has actually, Records Online, being able to see the record, has enabled me to trust my doctor a bit more, and it's actually improved my own relationship that I have with my GP in practice. So thank you very much. Thank you.